watching. Please like and subscribe to help us spread Teepa's positive approach message around the world.
And we are here for problem solving with the PAC team. So we've got some folks in our Zoom room. I'm going to do a little intro. Oh, good. There's Beth. She popped in. I was just getting ready to invite her a different way. So we've got Rachel. Say, hey, Rachel. Now that's just waving her hand. There you go. And Rachel will be our keeper of all questions and the monitor who gets us all where we're going to be with questions and who's talking and keeping track. We have Shelley, who is taking Matthew's place tonight because Matthew is off with his son doing something. And I'm trying to remember, this morning we talked about it.
He got invited into a special program at his school. So
there you go. An encouragement, do it program. And so he's there getting signed up to do that. Yeah. Wow. And so then we have Cheryl Buckholz up there in Canada representing practical care. And we have some, Samantha is down there. She's in Texas and she also is part of our mentor crew. And then we have Beth Nolan there. Hey, Beth.
Hey there.
Flying in on a wing and a prayer. There she is. She's up there. She's actually up in Michigan near Grand Rapids. So if you're looking for advice from Michigan, there you go. We have Denise Butler, who's a friend of ours who lives up near the coast of Virginia, near Newport News or someplace else. I think that's.
We're near Newport News. We're in Williamsburg.
Williamsburg. I was going to say that doesn't seem quite right. I know that wasn't quite right. We have a good friend, Jill Costello, who comes to us from Savannah area. Yeah, Jill.
That's right. You got it.
Yeah, she works with Savannah Hospice and palliative care. So we're good friends with her. We have Esther, who has a mom that she tries to support. Yeah. And is supporting, as a matter of fact. We have Sandra Acker. Sandra is a friend of ours. Also, Sandra's supporting her husband and herself.
Yeah, and I'm usually in Canada, but I'm in Pittsburgh tonight. So
I know. I was going to say she's usually in Canada. She says she's in Pittsburgh, which is one of my hometowns.
Yeah,
and then we have Jeffrey, and he's down there in Colombia, and I'm not talking South Carolina. I'm talking the South America, Colombia area. And he's caring for his wife and he has wonderful support people in place. So we are here tonight to do some problem solving with the PAC team. And we've got the team sort of with us. So Rachel, kick us off with a good, interesting, they're always interesting question, if you would.
So I thought we might start off with kind of a general question. I have some specifics if we want it, but the general question is, any tips for transitioning or helping someone to transition to living in a memory care facility? So we actually do have someone who will be moving into memory care this week.
Ooh, so we have a specific situation.
So we have a specific situation somewhat, but there's also just some general, what are some things that are helpful. They're actually moving stuff into the room today or this evening. So this is getting very real for them. The wife has been the primary care person, and he's been living with the disease for the past 2 years. She said that he's lost most of his ability to communicate. And over the past month, he has had some significant decline. So something that they've been dealing with is him coming in and out of the bedroom, feeling like every 5 minutes to tell them that he's going to go to bed. And in all caps, it says all day long. So this is a very constant thing. And he doesn't stay in bed unless someone is in the bed with him. So he gets up, comes in here, I'm going to bed, and then goes down and comes back out. So they've tried to figure out what's going on. They've tried asking, what's bothering you? Are you in pain? He no longer watches TV or does puzzles. He doesn't want the bed to be elevated, no massaging, and pretty much everything is a no. The one thing that he does sometimes like to do is walk in the mall or ride in a car. So they're thinking that they're probably approaching the later parts of the dementia because there seems to be very little that he does or will do. And so they're feeling like he needs to go into a facility because it's a 24/7 job to care for him. So that's a little bit of a background. So basically, what are some ways to make this transition go smoother?
Okay, so we're going to take a step back from the specific case and we're going to talk about moving from place to place, switching places. And it's a very different place. It's a very different environment. There'll be different people there. There'll be different things there. There'll be different programming there. And there are so many possibilities this could go badly. I mean, lots of possibilities. And just a few possibilities this will go smoothly because he's already, and people who are already in a state of what I'd call fairly distressed state, they're not settled. When we go changing one more thing, I would expect things to probably dip a little more. That's my personal thought about it, just right off. I'm not expecting it to go, yeah, this is going to be great. Because it's already rough and communication is an issue. So I'm going to turn it over. I'm going to kick us off. Let's see. I'm going to start with, let's see, Cheryl. Cheryl, what are some things you're thinking when people are going to transition from place to place? They've been in one place a long time with just one or two people. And now we're going to move them into a setting where there are lots of people relatively and lots of rooms that are unfamiliar rooms and a pathway that's going to be very different. What are some things that come into your mind?
Oh, many things come into my mind when that transition is happening. So, type of support that he's going to have during that transition, who he has for support, as well as so many.
Tell me more about that. What you're thinking there, Rachel, Cheryl. Tell me more about when you say who he'll have for support. What do you be a little more specific so folks could get their head around that?
Yeah, so is his wife going to be the only person providing that support during this transition, or does she have other people providing that support as well? Is there family members involved? And yeah, and kind of like
What's
going,
wrong, Cheryl? Because
I
you're
don't
usually not at a
know.
loss for words. And what's going on for you?
Well, I listened to like what Rachel was saying on how he's coming out of the room. He's already a little bit lost in awareness of,
In a familiar place, in a place that has been familiar and he's been
right?
comfortable in. And he
Yeah.
used to have a pattern of behavior and it's changed fairly dramatically in a fairly short window of time. I mean, this is, Rachel, am I right? This hasn't been going on that long. This new behavior is relatively recent.
I believe so.
Yeah. So we've got a really different behavior than we've seen before from what we're hearing.
And it's all day long that it's happening now, that he's coming out with his wayfindings. I believe that he's lost in his wayfindings as well.
So are you feeling like that they're asking him if he's in pain? What's your thinking about what do we need to know about him to know whether that's something that's going to be the best way to try to assess for discomfort or pain? What do you think?
Yeah, so is there an unmet need that he is coming out each time saying, okay, I'm going to bed. Okay, I'm going to bed, but he's still coming out.
Mm-hmm.
So definitely, is there an unmet need there for him comfort wise? Is there something that he's waiting for, like pain, like you said? Is he in pain? Is there an unmet need happening in this moment?
Mm-hmm. So I'm going to ask the bigger group here, what kind of things come to mind from unmet need? If I were to say unmet need, what kind of things are coming into your mind? Like, I wonder if, because you got curiosity. I'm sure some of you have curiosity. What kinds of things? Go ahead, Sandra. What's one or two things you're thinking about?
Well, I'm wondering, nobody said anything about his eating and how that fits into this other behavior. pattern.
Okay, so is he eating the same? Is he eating less? Is he eating more? Is he eating differently? So eating, taking things in. How's that going? You're curious about that side of it. Okay, what else? Yeah, go ahead, Esther.
I was wondering what his usual routine, bedtime routine would have been. Maybe he wants to go to bed, but maybe there's certain things that he feels like he needs to do first before going to bed and doesn't know how to get to do them, like, or initiate them, like taking a shower or saying his prayers.
Okay, could there be a missing part of actually going to sleep? Like getting to sleep that he's missing? Maybe going to bed, but not having an element that's part of his ritual or his routine or his pattern. And I would tend to agree more if he was already in a new place where his wife wasn't around. So because the wife's been the primary carer for a while, I could be wrong, but I would think classically, typically spouses would say, we used to do this and now he's not doing that anymore. And there wasn't anything that in the conversation, was there, Rachel, in the info that, that he had stopped doing something? It's more that he just comes back and forth, back and forth, back and forth. Does he get his PJs on? I guess is one of the questions. Does he actually get his pajamas on, or is he just sleeping in the same clothes he moves around in? Which is not, I will say that gets more common as we move later in the condition where people don't want to change clothes so much. And we put on things like sweatpants and t-shirts that, worst comes to worst, you could sleep in them. You could also stand around and move around in them. And so we have more options to do shifts that don't have to be time sensitive. So it gives us more flexibility. Jeffrey, go ahead, Cheryl.
What's throwing me off a bit is that they're already moving this stuff in. That's where my brain was going, ooh, do they have, like, they're already in the process of moving him in this moment.
Yeah, so it sounds like they've gotten to a crisis where mom can't keep doing this.
Right.
It's wearing her out and she's getting more and more worried, because I'm thinking my best guess is he doesn't recognize her so much. I don't know that though. Rachel, do we have anything about her facial recognition or noticing who she is?
They did not say that. I got the feeling it was the constantness and the not wanting to do things, refusals, and just the constant of this, the wearing, the 24/7.
That nothing's
That's the
happening.
piece
What
that
about,
really came through?
yeah, what about that? It sounds, am I right remembering that if somebody lays down with him in the bed, he'll stay in it? Is that
Yes.
the impression you got?
Yes, she did say that.
Okay, so that means she's wanting him to go to bed when she's not in the bed, but if she will go to bed and lay down with him, he stays there. That's the impression we have, yeah?
If somebody stays there, and the other thing is something has changed in the last 30 days, I think that may be something important.
Yeah, so there's something changing here. This is a new thing. And I'm going to go to your hands up, but I'm going to say classically 30 days is a really fast switch out for this kind of shift. So for me, I'm thinking there's something else here. There is not just dementia here. There's something else happening here. It makes me really curious about what else could be going on. So Jeffrey, now I'll call on you with your hand up.
Yeah. The going to sleep if someone's in the bed, I've lived through that all the time. The other night I had to get in, the nurse called me at 4 o'clock in the morning to help get into bed to calm my wife, and then took half an hour to calm her down before she went to sleep, and then only slept 2 hours. But what I was going to suggest, other things are, for example, you talked about the routine, but is he tired enough? Does he get enough physical activity during the day? They said he likes to walk in the mall. Is he still doing that? Is he getting out and getting exercise that will then get him tired so that when bedtime comes around, he'll be willing to sleep? And the other thing was just, we were talking about input. Sandra was talking about input. Well, what about output? How are his bowel and urinary movements going? Everything okay, or is there any risk of there might be an infection somewhere that we don't know?
Or
is causing
something's
this
bothering his
behavior.
bowel and he's really uncomfortable. He goes to lay down. He can't get comfortable. He gets back up. He's still not comfortable. He goes to lay down. He's not comfortable. He gets back up. He's still not comfortable. So it could be in the gut system or the bowel
Yeah,
system.
my wife gets I give my wife she gets a colon massage every night when she goes to bed as part of her going to bed ritual, because we want to make sure her bowels move. So
Yep.
the colon is
And that
massaged every evening right
that
after she gets in bed.
love, that little love massage that you can give babies, you can also give human beings, and you can also get people to sometimes do, let's twist again like we did last summer. Let's go down limbo. Let's do, let's move through the middle of your body to help your colon actually do its large intestine do its job. Chris-Ann, what do you got on your mind there, my friend?
I agree with a lot of what people have said. It's really a fast turnaround. And I wanting to make sure we had a full medical exam, and it's a urinary tract infection until proven differently, in my opinion. But I think that's one of the things that we would really want to look for. And the anxiety that seems to come on, I think sometimes I'm afraid that I'm going to lose control. And so I'm running to the bathroom all the time just because. And
and he's not going to the bathroom. He's not making any efforts to do anything with his zipper or anything, doesn't sound like, which would be really nice cues to help us out. So the challenge is, can he give those cues? I mean, is he classically able to give those cues and we're not seeing any of them, or is he not classically able to give those cues? So we couldn't see them because he doesn't have the ability to show us. Now I'm going to take us back. I'm going to pull us back a little bit here. And I'm going to go to the two human needs that I think I'm really questioning. Could he be uncomfortable about something? Is he uncomfortable about something? And is that something he's uncomfortable inside him or outside him? Or some combination thereof? And if he's uncomfortable enough, has it actually switched to pain? And the pain is so significant, he's picking up on, and I'm going to give you an emotional pain. He's picking up on the idea that people are frustrated with him. They don't know what to do with him. He doesn't know what to do with himself. He doesn't know how to have value and purpose. She's getting frustrated. She wants him to go lay down. He keeps getting back up. He won't do what she wants. And so I'm wondering how much of distress that both of them have been experienced, which is why the move is happening, because, we can't keep going where we're going right now. I can't take it anymore. So who's in pain?
Both.
Everybody.
Both. Everybody's in pain. And so the question becomes has there been a change in med? Has there been a change in any kind of habit like mouth care? Have we seen any change in mouth care where we could have pain in the mouth? Have we seen any shift in gait where we really see him changing his gait a little bit? Maybe he's had an unobserved fall and he actually has a fracture somewhere that when he goes to lay down, it's super uncomfortable, or he has a bruise somewhere that's deep and internal. Could it be that he's really laying down and he gets short of breath and he doesn't like being short of breath, so he gets right back up? Does he lie back in the living room? Does he have a seat in the living room that he could take a rest on? And would that, is there anything along those kinds of questions? So, okay, now let's see, Beth, you haven't had a shot at this yet. What you thinking?
I guess my first thing is kind of way back even more so at the description words. And this is to say very clearly, what we've got to go off of is the care partner's view of things. And I never doubt the care partner's view of things. It is 100% a reality. It's also that person's reality, and it tells me a lot of clues about what I may not really know enough of. So like you said, you mentioned that there wasn't a lot of words about what has worked in the past. And that tells me potentially, again, this is not a blame thing, because the bottom line is this woman is exhausted. I can't imagine, I think about the times of how long I could stay up or how late I could be stay up at a 20 something or even a 30 something, or even honestly as a 40 something. But the older I get, the more my sleep affects my skin, my bowel movements, my achy joints, my ability to fight off a cold, all these little things that are subtle feeling changes that go into this idea of discomfort.
So
And
let's keep going,
yeah.
Beth, because you're talking about fatigue, and that's a feeling.
Yes.
But what do you bet that there's some frustration, at least?
Oh my
There's
gosh. So
definite sadness.
yes, there's everything here. All the unmet
Being
needs.
trapped and yet abandoned at the same time, feeling scared and tried everything. I don't know what else to do. I can find no value, no purpose. Nothing I'm doing is working. I need
And how
to,
long?
somebody else has to, I don't know what else to do.
Right. And how long has this gone on? And that's the piece that I think once we get to that place where we're so exhausted, we're so frustrated, we're so scared, we're feeling like a lack of purpose in terms of like, why couldn't I do this? Why couldn't I help my husband? Especially if I'm watching Teepa videos and everybody talks about these moments of joy and where's my moments of joy? And whether it's that sort of emotion or whether it's just this feeling of emotions, in those moments for myself, I know I can't trust my hippocampus. I cannot trust my time awareness. And at that point, I have to call timeout and call my friends and say, okay, I've either got to start taking notes with dates, or I've got to have somebody else come in and truly evaluate this in real time or on a regular basis, something where I'm reporting in, where I'm not relying on my memory.
Okay, so Beth, you picked a 5P and you picked person. We're going to change the person somehow, some which way.
I would say it's how I'm going to
change the props.
It's definitely the person, but I wouldn't say, I don't think you're saying this, but like the implication that there's something wrong with her. No. You're not saying that.
I need another person involved. I need another person involved. If I'm going to keep the place, I've got to change people.
Or even if she's not going to
keep doing it the way I'm doing it.
No, yeah.
Yeah. So, and what she has opted for is, you know what, I'm going to change place because there will be different people there and I'll get a break and we'll figure it out. And what do you think her thinking is about an assisted living memory care center? What do you think, given where she's at, how clearly, what do you think her first thought is about assisted living memory care center? What is she thinking?
They know dementia.
Yes. They got this. They'll know what to do with him. I mean, they will know what to do with him because I'm at a loss. So I'm going to take him to the experts. There we go. We're going to take him to the experts who will know dementia and know what to do at this point because he's further in the dementia than he had been, must be. And so they'll know what to do. And so that's her entry. I mean, that's what she's thinking. I'm going to guarantee it right now. What do you think?
Well,
Yeah, sure.
I like what you're saying. I agree with what you're saying, as well as she's reaching out to say, how can I make this smoothly? How can I do this? Like, so in both ways is like,
I still want him to get the right care. I just don't know what to do.
Guilt, right? But I know that I can't do this, but I really want to make it the best for him. Just bad, right?
So we are going to do the transition. So, okay. So, and I'm going to do Jeffrey and Sandra, but then I'm going to have us say, okay, guys, so what do we recommend for the best quality transition here, given that we have lots of questions about whether this is even dementia that we're looking at these changes. So thinking about that while Jeffrey and Sandra give us some things. Jeffrey, go ahead. Let's have you go first.
I was just going to say that the wife, I don't know whether she's aware that, when as dementia progresses, our loved one loses cognition. They can't really understand or use logic, but they really pick up on our emotions and our feelings. And I just lived through it this weekend on Saturday, Sunday. I mean, I have so much support. I have only one day a week when I'm totally alone and caring for my wife. And even that is very difficult. But so I got frustrated. My wife picks up on it, and then you get the incontinence accidents and all this stuff. She won't tell me when she needs to go to the toilet when I'm asking her, but I'm not being in the right mood. And And so, I
It's
mean, I
great
just
that
think
you
it's,
know it, but you still can't do it.
I still
You
can't
know
do it
what
all
you're
that
doing when
well.
you're doing it, but it's like,
I know
no,
I'm doing it
goodness,
wrong,
why am
and
I
I'm
doing
glad
this?
that I'm
This
only
is not
doing it
working.
wrong
Ugh. Yeah, you
a few
feel it.
hours
You
a
feel
week.
it. Yeah.
Because I have so much care, as you know, I have full-time, pretty much full-time nursing care for my wife, except for a day and a half a week. And I have a live-in housekeeper. And there's so much, it's still hard. It's still hard. And it's just, I like to say it is what it is, and it's hard. But I was just going to say, remember, has she tried things like music at all? Or because remember when it works for my wife, when she's all agitated, I start playing agitated music, and then we shift to something calmer and try to get her that, and that helps calm my wife down. And I think sometimes people are frustrated. I know in support groups, the loss of the relationship and intimacy in the relationship, because the intimacy is gone, and then all she's got is this care. But I just like to say there are other ways to find intimacy, because I still hug my wife. We still cuddle. I can't do it as much as I'd like to, or she'd like to. But there still is that. And I don't put her in front of a TV all the time. She's right now, literally, she's pacing through the apartment. She's just walking back and forth, back and forth, back and forth. And she has a nurse with her holding her hand, make sure she doesn't fall, make sure she's taken care of.
So that pacing, you've described what he's doing, which is pacing, but he has an endpoint. He has an endpoint in the living room and an endpoint in the bedroom, and an endpoint in the living room and an endpoint in the bedroom. So it could be that he's walking like he did the mall, but now it's just back and forth, and there's no time frame on it. So it could be along that line.
Yeah, and he might be, my wife is not the age where I mean, it was a little sad. I was on my own on Sunday with her, and she looks me in the face and says, "Where's Jeffrey?" And then one of the things she does when she gets, I can tell when she's uncomfortable or upset, is she starts asking to go home. It's just what she does when she says, when she's uncomfortable. So I always just say, "I'm so sorry you're feeling uncomfortable, but I know you're safe," and try to work something out. But
So you've got some
yeah, no, I mean, I just
strategies.
think one of the things that I wanted to remind this woman, though, that you say is that, I think I heard it from you, is that, correct me if I'm wrong, there is no state licensing requirement for personnel working in memory care facilities. So they are not necessarily the experts.
Yeah.
They do not necessarily know what to do.
Yeah.
They will
And
not
that's
necessarily care for your loved one better, even though you're paying them a fortune.
Yeah. I mean, and some places are absolutely great because you have people who do have experience and they choose that. There's no requirement for it, though. I mean, and that's the tricky part, is people think, yeah, there'll be care. And the challenge is, well, it means the door's secured, and there are people on the other side that might be personal care assistants, they might be CNAs, they might be people that came on the job yesterday and college students. I mean, and there might be a nurse in the building, there might be a nurse in the area, there might be a nurse on the floor, there might not, they might be an RN, an LPN, they might be doing MedPass as a CNA. I mean, there's all kinds of levels of ability that are going to be present there, and they vary a lot. So yeah, there's no guarantee on that. So Sandra, a final thought there on your side.
Well, I mostly had questions.
Okay.
The way the information was presented to us, I feel like I don't know anything about who else has been involved in caring for this person, but I can see, my impression is that the wife just wants to turn it over to
She's just
somebody.
needing a break. She can't figure anything else out. I mean, how much training did she get before she took the job on? And she's been trying really hard, and it's just really getting to a break point where she can't figure it out. Yeah. So transitions that make it better. Number one, I believe he needs a good evaluation, and I'm not talking about a dementia evaluation. I'm talking about a good evaluation to see what else could be happening here. I believe that there's going to need to be somebody who's going to watch and monitor this kind of thing, because his risk of falling is going to probably go up in a new environment with new boundaries and markers. He's also likely, if he is having wayfinding problems, he's likely to get into other people's spaces or places and cause issues, because he'll lay down and then get right back up. But people don't want other people in the bed in their room and doing that. He may be really anxious or nervous about being away from somebody. So if that's the case and she's exhausted, it's not really okay to ask her, come and be this person. So, but that's where what resources are available. Who's in the friend pool? Who's in the family pool? Who could take some responsibility? Is it possible in this facility? Because it varies. Somebody could stay with him in his space as he settles in.
Yeah. And Teepa, that idea of that if we know the transition is going to happen, they talked about this 1 month thing, right?
Mm-hmm.
And unless we have like a snow event for me in Michigan, or something like a big windstorm that I mark it on the date of my calendar, I can't track a date. And some people really can. Some people are much better than I am. But a 30 days when I'm busy, if I'm hyper focused and every day feels like the same thing again and again, and we hear those words about again and again and again, I think, to track to see whether it is a delirium, a mental health change, or whether it is a dementia change is going to require more than 30 days to track this. And at that point, I don't know if the facility necessarily is going to have the ability to track that unless it is part of the care plan initially. So this idea we've talked about before of getting something where we're going to have a perspective, and we lose perspective so easily. I think I've told the story before, just by comparison. Make it much simpler. You think you'd be able to track whether or not a dog who you're giving medicine for is having explosive diarrhea. One would think that would be memorable, because every morning when I went to go get the puppy out of the kennel, it was, did I have to give the dog a bath before I went to work? And after a while, after several weeks of giving medication, finally, I was like, I'm done. I've had it. I'm doing this every day. This is ridiculous. My husband said, time out. I think Stanley's getting better. Why don't we get a calendar? And every morning when there's when there's diarrhea, you make a big old X. And the one day I went down there and sure enough, diarrhea everywhere. And I was going to lose it. I was like, I don't have time for this. He travels all the time. And then the dog, every day I give it a bath. And I turned in my frustration. Luckily, I hadn't started taking this out on the poor puppy.
Mhm.
And I looked over the calendar and I realized it had been 5 days since the dog had had diarrhea. And all I thought immediately, my ability to have sympathy for this animal was, I said, oh, baby, you must have gotten into something. It must be something new. And it was that perspective. I don't know if this poor woman has that at this point, because when you hear things like they're always getting up, they're never sleeping, they can't ever, this is constantly happening. Bodies can't do everything 24/7 for a month. So if this transition, when it happens, I really have that place where I'm like, okay, if it's not you, then as you are bringing in this team, what part of the care plan is going to be the tracking of what's going on? Because no one's going to be able to have perspective if I don't even know the person as a health provider in nursing homes. So I'm curious to you, what sorts of things would you say going into it we should track right away?
Well, I would, before we get too far along, I would want to look at the med list and see if there are meds on that list that might be triggering this, even if the person has been on those meds for a while.
So a med review.
And if we do a med review and make sure we're thinking atypical reactions to some of the meds, or hyper reactivity to meds that I've been on for a while, but all of a sudden I'm having reactions. I would be looking at input output. For sure. What are they putting in? What are they putting out? When do we not see him getting up? Because if the only way he'll stay in the bed is if somebody's in there with him, what do we have planned to have him feel like there's somebody in the bed with him? Because otherwise, when's he going to get any rest? If we're really accurate that the only time he'll lay down is when someone lays with him, my experience is pretty extensive, and I certainly have been in one or two facilities where I have myself laid down with someone. But I will tell you, I don't know that I've known a facility that, as a habit of practice, encourages staff to lay in the bed with people. I mean, I've not been in a facility that went, that's just what we do because we want to support people going to sleep. And for many people who've been married for years and years and their partner isn't with them, we often lay down and help people calm down and settle in. And then we will put a body pillow in place. I have heard about people trying to use fake people in beds. I'm not sure how that works out. I myself would be a little freaked out to find somebody in the bed that was sort of poofed up.
The mechanical cats that purr. That's something I've heard is also successful if it's not the
Yeah.
body pillow.
Yeah. So, Chrisanne.
Takes me a while to unmute there. You know, this, I feel my heart goes out to her. And burnout is real, and it's you know, the health of the people who are providing care suffers greatly. And you know, my heart goes out to her. But I also think as that burnout, someone mentioned it, you know, we can't always articulate it. And I think as our senses diminish, others heighten. And I know that's for me. I sense the tension around and I absorb it rather than I'm, you know, used to be able to calm that chaos. And now it's much more difficult for me. I tell everybody it depletes my dopamine when I have to do that. And so I think that that's a real need. And I can't help but think he's feeling that and missing that care and missing that presence. You know.
Yeah. So both of them are. So I think the smoothing the transition, who else is going to need care during this transition?
Absolutely. She needs a hug too. She needs a squishy
She's going to need more than a hat. I mean, she's going to really this is going to be a rough transition for her because it sounds like care support is not 100% for her to start with. So being smart about that. So Rachel, have we done enough conversating on this that we feel like we've got some thoughts? Anybody else have a final anything that we absolutely have to cover here, or are we good? What do you think, Rachel?
Well, we certainly talked about it a long time.
Now, Rachel, that sounded judgmental.
Oh, I'm sorry.
Do you think we covered content well enough?
Sure.
You're right. It did take us a while.
No, it wasn't that. It's just, I think I'm kind of like Chrissy, I think it hurts to know what they're going through. And I was just listening to it, thinking of them listening to this, and I wasn't sure how helpful it was going to be, or maybe it would be helpful, but it would be pretty discouraging. So I think that's why I answered the way I did, because it is pretty, it's a really hard place that they're stuck in. And that's, I think, why I responded that way.
Yeah. And just so folks know, Polly and I sent a missive back as soon as we got the information in. We didn't hold off on it and wait. So we sent something back right away. And we don't know exactly where things progress from the time that we first heard this, except now it sounds like, you know, it has to move forward to something because it was not shifting in a way that was healthy or helpful. So I think she's tried what she could try, and it's time to try something different. The tricky part is getting her enough support and him enough support to try to figure out what's happening in a good way and maybe figure out how he can settle into something. But we won't know if we don't get super curious. And that's the one concern. Not thinking, well, he's moving in, of course he's going to be agitated. We already knew there was something going on. So we got to be super curious about what might be underlying some of that. So, all right, we're going to move to another topic. Yes, Cheryl, I see your finger.
Thank you. I would like to offer the consult for his wife to offer consult at.
Help with the transition. Okay, cool. Thanks. We will pass that. We will pass that along for sure. Thanks, Cheryl.
Okay.
All right, Rachel.
So our next question, the kind of overarching question is the idea of how do you deal with delusions when they are in full swing? They've heard that you should agree or go along with it, but they're concerned what would happen if they did that. So kind of a backstory, we have someone who has dementia, but does not really have a specific diagnosis. The people in the area are not necessarily real specialists in that area.
Okay.
So because the husband's not been real proactive about getting a diagnosis and doing all that, the kids have tried to step in. And so they've tried to get her into an out of town testing memory sort of clinic, but they're on the waiting list for 6 months. So in the meantime, she's having daily episodes, sometimes multiple times a day, saying that her husband has never given her any money, never gotten her anything. She wants her husband out of the house, wants a divorce, to the point where she's called the police, saying that, you know, he's physically harmed her. Of course, the police never see any evidence of that.
Right.
And this has happened multiple times. Then when it's over, she apologizes and she says she doesn't know why she's doing and saying what she does. So
Okay.
the doctor put her on a prescription to try to help with the agitation and aggression and said, well, it might take 4 to 6 weeks to help, if it helps. So they're waiting, and they're waiting for this, and they're waiting for the specialist appointment. They're waiting for the prescription to work. In the meantime, she and her sister are dealing with multiple calls a day. They drive up when they need to, but this has taken a toll, and meanwhile, they wait.
Well, you saw the number of head shakes going, seriously? This is the recommendation that's being made, and that's it? That's all that they're getting? You know, like, we're going to wait, and we need to take 4 to 6 weeks to find out if an anti-anxiety med is going to reduce anxiety, or an antipsychotic med is going to reduce delusional and hallucination. That's really a long time, in my experience, to see a shift towards something more positive and less problematic. But I'm going to put it out there to the group to see if I'm the only one that's feeling this way, that, wow, interesting. So 4 to 6 weeks to see some kind of shift in anti-anxiety med.
It depends on the med, right? I mean, in truth, we've got ones that are very much, you know, fast
Which
acting.
one are you thinking, Beth? I mean, which one is 4 to 6 weeks?
I mean, if you're treating something other than anxiety, then sometimes, but even then, I think it's like it's trying to, maybe the doctor's like, okay, don't expect something right away. But I gotta say, even without the meds, it's, to me, there's like a big pause here, even going farther back, you know.
Yeah.
Wow.
I mean, but this last one with the meds is like, wait a minute, we're not even willing to hear that they're in distress, they need help, and we should be doing something definitely more proactive, instead of, we're just going to see how it all plays out here.
And especially when the woman claims very clearly to then get to a place where she has self-awareness, to the point where she's apologizing. This is a woman with some serious abilities that we could really capitalize on and use, and recognize what the unmet need is.
Yeah, and recognizing that most of the delusions that she has are referencing her husband funding, hurting her, not listening to her, not taking care of her. They're pretty consistent in a pattern. This is not like one-offs all over the place. There's a pattern here of feeling not listened to, that people are doing things that, her husband particularly, is doing things he shouldn't be doing. And yet when she comes back into being aware, she goes, oh, I'm sorry, I don't know why I did all that. I mean, it's just crazy. And she has some memory of it. So, Sandra, what do you have to add in here?
Well, I'm not a doctor, but I know that Ativan, or whatever it's called, can work pretty fast to help. I mean, I
Or
know
not.
it's,
I mean, you'll know whether it
Yeah.
helps or not, or makes it worse, which, why might it make it worse? And it's called that paradoxical. Why might it actually make this woman worse? What's a reason for that? Anybody got one? Even if you're not a doctor, because we do this work a good bit.
The type of dementia that she may.
Oh, the type of dementia. And because we're waiting to find out the type of dementia, you know, what if this person were to get this anti-anxiety med or whatever med it is, and they do get worse? What do you think the next step would be from the provider that we've had so far? What's our concern the next step would be?
Oh, they'll increase it.
Increase it or add another one. And that's like, whoa, 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 let's pause. We don't even know what kind of dementia we're working with here. So Sandra, that was your sort of thought is, wow, you know, that's a long time to see something happening. And if indeed it is, they were worried, they didn't want to give her an antipsychotics. They did it. We don't know what kind of med it was. We have no idea what the med was. Was it for psychoses because she's delusional? Or was it an antidepressant because they thought it was depression, or anxiety because they thought it was anxiety? What's the med supposed to be for? You know, what is it? Was it Nuplazid because they thought she was having hallucinations and delusional thinking? Like with Parkinson's, Nuplazid is the medication that they will use with Parkinson's. So, I mean, there's a lot of unknown, but to just offer a med and say it'll take a while when someone's in acute distress, family-wise, and the person is not well. I mean, they're not well. So, Jeffrey, what do you want to bring into the conversation here?
Well, I was just going to add that 4 to 6 weeks, and when my wife was first put on antipsychotics, which we know I don't recommend, I've learned the hard way because of long-term use caused akathisia, but it calmed her down within 2 hours. And within a day or two, she was back to taking her medications and everything. And the delusions, she had delusional behavior, and the delusions went away. But what in learning or reading up on all these meds afterward, because my wife's been on 4 different antipsychotics now, and what I learned is a lot of it is trial and error, and the most effective antipsychotic, risperidone, is only effective in something like 30 to 40% of cases. So the med doctors really don't have a lot to work with, which is why your approach and think about other things is a lot better, I think. But what in this case, what strikes me is that this woman seems to be early to middle stages of dementia, because she's recognizing and remembering her behavior and apologizing for it. So I wonder whether any of these meds are actually appropriate given that that reality, shall we say.
I mean, and so what the kids are identifying is, should we go along with her delusion? How do we go along? I mean, how do we work with the delusions? So, and that's really what we're going to focus in on. But I do want to really yikes. Okay, this is a challenge because the support you're getting is totally inadequate. So, Chris-Ann, you wanted to bring something into the conversation before we move forward into working on those delusions, because we do need to just cope with that. That's what we're going to talk about.
Well, I'm not a doctor, nurse.
Okay.
Antidepressants across the board, they work about 30% of the times, and they take 4 to 6 weeks to work.
Or 8 to 10, depending.
Yes.
I mean, it can be 8 to 10 to actually get to full impact.
Right. And
yeah.
The hallucinations and what have you, I think again, a full medical workup really needs to happen. We need to be checking all her electrolytes, her B12, her thyroid, we can just keep on going and seeing what is it medically. So rule out all of that before you start doing a lot of other things.
Okay, so we're not even sure at this point whether or not she's gotten a really thorough workup just with, has she had a really good workup for well-being in general? And then we're working on which dementia is it. Rachel, do we know for sure that there was a workup for well-being and labs were drawn and things were done locally or not?
No, we don't know that. They went to a local neurologist, but for some reason the husband never took her back. So the primary referred her to an out-of-town memory health testing facility. But that's really all I know.
All we know. Now, I will say, in general, neurologists are going to do the kind of things you're talking about, Chrisanne. It's unusual for a neurologist not to do that kind of workup. I mean, it's possible, but it's unusual. So my best guess, just from rough data, is I'm curious about the possibility of some Lewy body involvement. So I want to ask some other questions about what's her sleep pattern like. Tell me if she had any falls. Have you noticed any episodes of having difficulty using her hands or fingers, or trying to have trouble with balancing and coordination? Have you noticed anything about, this seems like a real pattern. Tell me about, how often you've noticed waves in the pattern where it gets really bad and then it gets not so bad, and it gets really bad and it gets really pretty rare. Have we noticed any changes in eating or smelling things, or the flavors and tastes and touch? Anything about those kind of things? Those are all things to be curious about. But for right now, we have this condition where she is having hallucinations are just delusional. It's delusional thinking, it sounds like. Yes, Rachel?
Delusions.
And we haven't heard anything about visual stuff, visual disturbances.
And
So
I
we
think
don't
that
know.
if all those come back as no, I think that list that Teepa just had in there, and if you're, go to YouTube and rewind it again and go through that list, because it's a great list to really check for Lewy body. If the answer is no, this idea that I've heard the phrase you use, paranoid flavor. So I'm wondering if you could go through that same list, but now for, traditional, what we think of as a paranoid flavor, when I was the one who always managed the bills. I was the one that took care of the money and did all the executive functioning in the house. I was the one, and now my husband is taking over all these jobs and these roles that he didn't, and he's not letting me do it. He won't let me and now he's even taking the credit cards out of my purse. And so what's that same list if it's not Lewy body, Teepa?
Yeah. So now we're trying to figure out, okay, so is there some role changes that have been going on here? And are we having a woman who she might have some issues with sequencing, with the ability to be logical and reasonable? She's really seeing herself still as capable, and her husband, she's now seeing as him as not being helpful and not listening and not wanting her to have stuff. And then she sort of resets and she's, well, I'm sorry, I don't know even why I said that. So the emotion wells up in her and then it goes away. Now, I'd be really curious now whether or not we're having any language shifts or changes that we might picking up on, or whether we've noticed anything other than the finances and the worried about the what was the other thing besides the finances? Taking her money, doing things like that, hurting her.
There was hurting her, and there was physically abusing
her. But I'm wondering whether, if we ask the husband, are there times when she starts something and doesn't finish it? Are there times when she's going from task to task and not sure what to do? So I'm looking for, is it possible that we have another dimension? This one might be a really different one. And it's a frontal temporal type, or could it be just straight out Alzheimer's? Or is it possible that, and this is where we want to go back to, she's actually only MCI. She's only mildly cognitive impaired. However, because of this shifting, we're seeing a really psych-like component to it. That is because she can't wrap her head around why the hell all this is happening. And she's super frustrated. And then she gets less frustrated after she blows off steam. She dumps her cortisol, she dumps her adrenaline, and then her brain comes back online and says, I'm sorry, I don't know why I said all. Has anybody ever in a moment of anger said something, done something and then came back from that and went, I'm sorry. I don't know. I mean, I was just so mad at the moment. So we may not be even to like a full out dementia and have this issue. So if I were to say, why are you taking all the money? You never put any money in the account. Who do you think you are? This is my money as well as your money. And I've never had you treat me like this.
No, you never have, Teepa. You were
Yeah,
always
so what's going on here?
you're wondering what's going on here.
Yes.
So Teepa,
What?
we tell me a little bit about what you know about some of the changes that have happened that you've seen.
Oh, shut up. I'm not talking to you right now
No,
because
okay.
you just are trying to wallpaper over everything. You
Just
wallpaper all kinds of stuff.
And
This
it's
is,
not
I
fair.
never thought I'd have a relationship with you like this.
No, and you're right. It's not the place I wanted to be at all.
Well, then why are you taking the money? That's what I want to know.
You're wondering why I'm taking the money? So
Yes.
you're thinking I'm stealing from us as a couple.
Yes, that's what I think's happening because there should have been more money in there than I see in there.
There should have, there absolutely should have. You know what? I mean, to be honest, I mean, I know where it's going. Is that something we
And
want to figure
see,
out?
and why is it that I don't know? That's what I want to know. Why don't I know where it's going? I've always done this stuff.
You've always done that. And that's what I want to know too.
Okay, so I'm going to pause us. Now, this is the tricky part.
Yeah.
I'm early enough in the disease. How long is it going to take for me to come off of this hill that I'm on? Potentially.
Well, we actually talk about that in terms of probably about 20 minutes if you're really, really upset.
Uh-huh.
And
Yeah.
I've got to get that energy. And I tried to pull it down. It was too early. I came back up. I kind of went for the emotional in our relationship. And I'm going to fail and try. And I'm going to fail and try. I've got to be
What am I doing
hyper-focused on-
during this event? What's happening for my cortisol and my adrenaline? What's happening to it? What is Beth doing?
I'm trying to get it.
She's helping me dump it. It's the only way I can dump it right now. I mean, I can't let go of it. Everybody wants it to be done in 1, 2, 3, 4 back and forth. We're done. I have a lot of distress right now. And so the thing is, Beth will have to continue. Now, how tired will Beth be at the end of the 20 minutes, do you think?
But I get tired role playing. Rachel and I have joked about this, like how if you're really into it. And I will say the one thing that you have taught me as an extrovert, when I'm trying to solve a problem, I want to make connections as an extrovert and I'm a problem solver. I'm logical. I want to get at the problem this way. You have taught me again and again about this idea of if we are going to be in this together, I have got to put the problem out here for us.
Yeah.
And so we're talking about this in a lot of skills here, which are huge. So,
Yeah.
I mean, we'll probably do some more demos, but we've talked about how it is we're matching energy, we're dumping cortisol, how long it's going to take, and then physical movement. And I would say if you are a care partner, recognizing in this moment, you probably saw where it went up a little again, and so did my cortisol. And then I breathed and pulled it back down. And at the end, I was like way out here and trying to stay out here. This really does take practice because Teepa in this moment is got a purpose here. She's trying to show a realistic example, but she's not going to do it for 20 minutes. So I know I've got an out. And it's still
I love you, Beth. It's true. You know that we're not going to let anybody sit here and listen to us do this for 20 minutes because what would happen to you even listening to it? What would you find?
Your cortisol level out there just listening to that back and forth for what, a minute, 2 minutes? I got to look back into the timer now.
So what does everybody want to hand me to try to make this better?
Teepa pill and pill.
The magic pill. That's right. But all we're doing is masking what's driving this, which is my husband in this case is going to have to start thinking about, we need help. We need help at figuring this out. We need a different way of approaching the whole situation. Something that I'm doing for sure is triggering some of this. Now, it's not my fault. it's what's changing in her and what's changing in our relationship. But we got to figure something new out because this is not good for her. And really importantly, it's not good for him. It is so not good for him because this repeated boom, boom, boom of cortisol, even if you don't have dementia, is really dangerous for your brain. I mean, that is just a danger thing to do. So really becoming more skillful at this phenomenon so that you can do it when you're even doing it for real as a role play. You can actually separate yourself a little bit and you have to be able to do it. Jeffrey's mastered it. He's gotten to that place. Now, there are moments it still hurts when his wife doesn't recognize Jeffrey and she's asking for Jeffrey. That's a lot harder than she just wants to go home anymore. Because you've practiced and practiced and practiced. And you're never perfect. You're just keeping working on it. So Jeffrey, what were you going to add in?
I was just going to, it's amazing how much this helps me here, but you're making me think of my friend who's got mad at me 3 months ago when I accused her of having some kind of dementia. But she's never apologized and she's never realized that she's wrong or anything. She still won't talk to me. And but her husband is really having a hard time, obviously trying to figure it out. They did going through all the tests and everything. They're waiting for the neurologist report of the MRI, I think. But anyways.
And who's she going to hate after she gets that, do you think?
No.
Who's she going to hate after
maybe,
that? The neurologist.
I don't know. But
I'm not going to want to go see
probably.
that neurologist again because he's a quack.
Well, she's already talked about changing the neuropsychiatrist or the one of the doctors that they saw, because I can't even tell her. It's just so sad because if it is mild cognitive impairment, now is the time when there are actually meds that could help you. That have finally come out, but if she refuses to acknowledge that there's anything wrong with it, it's not going to be for another 2 or 3 years.
Refuses to or can't.
Anyways, I'll stop.
Jeffrey's like, yeah, Jill, what you got for me?
Yeah, hey Teepa. I have a situation. I'm really glad this came up this evening. A care partner caring for his wife, sole care partner here. And I believe in the past, he's been a little too forceful in wanting his agenda. And because the two areas she's really pushing back on is him going in the bathroom with her and him wanting to get her change clothes. And so we've talked and I've tried to explain that she's not seeing you as you think she's seeing you. But how can he get that trust back?
Ooh. That's a tough one because once you break that boundary with dementia and the person learns they can't trust you, because we think, I mean, this really tricky part. We think people living with dementia can't learn new things. Oh, I beg to differ. People learn and they learn whether I like you or I can trust you or I don't like you, I can't trust you. And our old relationship is not as solid. I can't count on the old relationship at some point. So you've got to figure out how to help me build trust in you. And if you break trust with me by forcing me, that's one of those points where we're just starting to really wrap research around. Now we have trauma. And we know that when we build trauma into a system, it's hard to get trauma out. So we know that we have to work with the trauma that both of us now have, because I'm shocked as your care partner that you won't let me do things you would have let me do before. And now all of a sudden you're like pulling back. You won't even let me in the bathroom. Well, we used to be in the bathroom all the time together. I mean, come on. I'd be sitting on the pot and you'd be taking a shower. I mean, I would do this and you would do that. But that's changing because when I was sitting on the pot, you weren't trying to take my clothes off. When you were in the shower, I wasn't putting my hands all over you in a care manner. I mean, if I put my hands on you, we're having a lot more fun. So, or getting risky or frisky or something. So this idea of we've really changed and switched positions, and for the brain that's damaged, it came out of nowhere. It's illogical that we're doing what we're doing. So we've got to be willing, and this is super hard if I'm a really caring, careful person. I got to let go of the changing as a task. And what I want to think about is I for sure can't do it in the bathroom. Wherever I was doing it before, it better stop. Because at that moment, that place is part of the trigger. That's going to push the trigger. I may have to look at, I'm not it right now. I can't be it right now. So maybe a girlfriend, a friend of mine that says, oh, you know what? I went to the store and I got this outfit and I want you to try it on because I think you are going to look fantastic in it. I tried it. I look like crap. Here, watch. Watch. I'm going to take off my shirt. Let me put it on. Oh, no. See now, but look at the color on you. Here, Jill, switch out.
Mhm.
I have to know your background. I have to know, is that a routine I could try? But I'm switching people because I can't get out of my own space. And that's often as a care person, when I've tried a lot, it's super hard to get out of your own head to really be present in the situation because I'm struggling because I so want to help. This is ridiculous. I'm having a hard time letting go of this is ridiculous. You need help. I'm here to help. I so want that to work. I can't make my brain let go of it. And it's like, I gotta let go. So I've got to let go of more than that. And once I let go, then I can only see the possibilities. So I've got to let go of the 5. I've got to go with the place, the person, the props. I got to look at props differently. I can't look at them as changing clothes, getting her cleaned up, helping her. I can't look at it like that. And I've got to switch the programming. I've got to make this program something that doesn't match up with what her memory is of what was causing the issue. And then finally, I've got to come up with a new possibility of when or what, or I've got to get something really a new possibility. So that if we were talking about either your case, let's go back to our original one. Guess what? Beth can't be doing the money right now. We need a third party because this, I'll be honest with you, I didn't mean harm, but boy, if you think I'm stealing, we need to get somebody else to look at the money. This is ridiculous. I've never meant for that to happen. I was doing the checks, but I'm making mistakes with how you feel about that. Let's get somebody else to take a look at this. Or I've got to figure out how we need to look at it together. Because me taking over and doing things is triggering. But I also need to sounds like being with that human being, that person is starting to feel risky. And that's why the person is describing this as, he hurts me, he's dangerous. Well, he is, but it's emotional hurt, not physical hurt. He's hurting her emotionally. And her brain is recognizing, I'm hurt. This is hurting. He's not treating me like his wife. He's treating me like somebody else. And so, man, that's hard. That's really hard in that moment to say, you don't like me as the person that I've always been in your life. I'm having a hard time letting go of that. So maybe finding that space to say, I need someone else to help me out here for a bit because we're just running into a brick wall.
It sounds like there's 2 adult children, right? The 2 daughters that I hear. I mean, that distant, there's a little bit of a drive and maybe that financing thing. I think about, the fact that my husband and I are not good with directions together. And when we
You
decided
can't clean refrigerator at my house. That's we really can't do that.
We could all identify something with our partner or our spouse that really does not go well when you try to do it together. And so one of our best vacations is then literally it wasn't about directions at all. It was all about just trains. And, so it's like, how do we then find that when we think we're the only ones in that relationship that can do something, then that's the time we say, pause, I need some perspective, because that's finances or even a showering, as intimate or daily as that seems to be, that could be something we could at least temporarily until that trust is built. I love that, Teepa.
Yeah. And I think you mentioned the kids, but I suspect they're coming in sort of trying to go along with it, but they aren't really, the bigger issue is how we're managing money for her is painful. How we're managing time and space for her is painful right now. And I'd say the same, Jill, with your care partner, how he's trying to take on the role of caregiver is painful to his partner because she sees him as a partner, not a caregiver. Now, the challenge is we haven't had anybody else in her world up to now because everything was okay. We had it handled. And now that we're hitting the brick wall is now we're going, oh crap, now what do I do? Because she won't let me. She's not going to allow this. And what we have in one sense is the woman on this side of the street who's saying, I think you're cheating. I think you're doing this. I think you're taking my money. I think you're trying to hurt me, verbalizing it. Over here, we have a woman who's basically saying, I'm not going to let you do that stuff to me, physically resisting the care. And so, but both of them are in the same situation where they have somebody who's trying to push the agenda and they don't mean it for anything but love and care. But unfortunately, the perception is you're trying to do something wrong because my brain is just wired enough to know this should not be happening the way it's happening. And unless we sort of like shake it off and really get in a different space. And I have a friend with Lewy bodies, so I'm real used to this, got to shake it all off and like figure out this new space I got to be in. And it can flip a switch just like that, where, somebody's trying to hurt or kill her. And it's like, whoa. And it turns out what was happening is she's trying to go down the hall and somebody was coming the other way. And they both stepped the same way a couple times. And then he leaned in and said, do you want to dance? And it freaked her out. Because it was confrontational stance, but it was playful at first, but he missed the transition from when it was playful to when it was a threat. And it only happened because it was Lewy body in that moment. But that trauma took like 4 hours to get through. And that was 4 hours of cleanup. No playing in the halls like that. But you never know. It could have been fine, but it wasn't. And that's where, you have to sort of just go, wow, well, that was a surprise. Let me see what we're going to do with this one. Esther, you've been waiting patiently. What do you want to add to the mix?
Just wanted to suggest a solution that worked for my parents in terms of the finances. My mom was always the one who has Alzheimer's to handle the money. And when she started making a lot of mistakes, my dad had to take it over. And that was World War III. But what he figured out was telling her that he said, and he did this, he set up just automatic payments to go to the bills every month. So it wasn't even him doing it anymore. He's just said, this is going to make our lives a lot easier. You don't have to worry about it anymore.
I'm not doing it. Yeah, I'm not actually doing it. The bank is doing it. And he turned it over to a third person. And then all of a sudden it was a lot less of a deal because it wasn't between them. It was out there in front of them. And they came, and the only thing you might try is to say, I've got an idea and I'm wondering what you think about this.
Right.
Yeah.
And
so
it totally worked for them.
Yeah, I've got this idea about what we could do about this because I know it's making you super unhappy. We could either have the bank do it but we'd have to go in every time, or we could have you could do it maybe the automatic bank thing. What do you think would make more sense? Because you're more the one who does this than me.
Yeah, I'm kind of used to writing the checks, but maybe we can try that.
We could try it. Well, that would be great because, I've never been good at it. And so therefore it makes sense. I shouldn't be putting my paws on it because I'm just not good at it to start with. So I'm wondering, you make sense. So do you want to try that? Do you want to try the automatic deposit thing? Because I'm thinking you've always been better at the bank stuff anyway.
Well, I wouldn't even know where to begin with the electronic stuff.
Well,
maybe
they
you
know
can call.
Well, you know what? Between you and me and them, let's see if we can, let's list the bills so we know which ones we have to get on there. Because you're better at that. So we need to get the electrical, right?
Yeah.
Because it comes
the
out.
rent.
Oh, and the rent. Yeah, you're right about the rent. And what about the water? Is the water come up too?
Yeah.
Electric. Okay. Yeah. So what we've got, and now you say electric, and I go, yeah, electric, you're right. Not Yeah, we got the electric, Esther. That's why we're having to do this, because see, you paid it 3 times last month, and that's what I'm saying. That's why we're doing, and you gotta, yeah, the electric for the 5th time in the list. Yes. But you can't make it something wrong. She didn't do anything wrong. She just can't hang on to what she just said. Yeah, which is,
exactly.
yeah, good job. That was, I mean, he was smart, he was wise, and it's a great idea. So Jill, with your folks, we just got to think outside that box kind of bit. Yeah. Chris Ann.
I love the approach. Meet them where they are and let's go forward together. I mean, that's the win. But I also have to ask, I mean, as a person living well with Louis, or living as well as I can
Yeah,
with
with Louis as you can. Yeah.
That's right. And the fluctuations are real.
So real.
More with the fatigue thing. And so I think, when I'm getting back to the other things, it's like, what's her sleep patterns? What's going on there? Is she carrying nightmares into her daytime? And there's so many things we can do with that. What is their history? I mean, I can tell you, had a complicated pregnancy, handed everything over to my husband. All of a sudden, we got pink slips. Our electricity was going out, So,
Live you learn, huh, Chris Ann? Well, we found out what he's not good at. Yep.
Whoa, no, great at other things. But, so I always have to hesitate a bit and say, wait a minute, there is some fear there. And maybe we need to think about that. And then let's think about her agitation and what have you. Where might that be coming from? There's things to help her sleep. That will help calm her anxiety during the day. There's dream therapy with psychologists that I have done that was just an amazing thing. So a lot of avenues that haven't been explored, I think.
Exactly. And so the idea of let's not fight. I think that's our main mission here, is to say, let's not fight first. And then let's get curious second. And then let's not be waiting for this and that 6 months, 4 weeks, 6 weeks. Let's be more proactive in seeking better support, because this is just like, nobody should be going through this for that long without relief, is what we're saying.
Right. But, there's also relationships over how many years. And, I jokingly said to my husband, I hadn't hit him in a long time. And I really did well. The first time was boom, 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 but it was to the chest. And evidently the other night I flopped and hit him right in the throat. And I felt really badly. But then I said, I'm so sorry. And I actually did shed a tear or two. And then I said, my aim's getting better, isn't it?
Yeah. And what I would say to your husband is, you need to move faster. I mean, step back.
So I guess
that's the thing about Louis, is when those moments happen, like being aware, do I step forward? Do I step back? Do I step to the side? Do I give you space? What's going on here? And not blame you for what you can't control in that moment, but acknowledge, wow, if that happened once, I need to be tuned in to the possibility it could happen.
Yeah, but don't always look like, oh, this is Louis delusion or Louis whatever.
No.
I think we need to unpack it as you
do.
were saying. So
yeah, no, you're absolutely right. All right, so we might have time for a very short something. Rachel, anything else you want to put into the pot here?
I don't have a short question, so I was kind of curious if someone in the room had something they wanted to bring up, because I know Darlene's here and we haven't been able to have Darlene here for a while, and Chris came as well.
Cool. Anything new on your side of the street you want to hear about, talk about, any questions you want to raise up? Because anybody in the room, we're open to a question. I've been reading lots of articles lately, when I'm not doing anything else.
Yeah.
What you got, Chris?
I just came back this past weekend, visiting my parents, and There's been some significant changes in my mom, in that I'm seeing that she's having more difficult time feeding herself. And also, what's the other thing? So they're trying to get a caregiver in the house with them because my father just needs a break.
Yeah.
So we're having a little bit of difficulty with my father because he is not very good at fibbing, is what I would say. So we keep referring to the caregiver as a housekeeper because we're trying to convince my mother that it's just a housekeeper coming in because she doesn't want anybody in to help her. And he keeps continuing to correct her and call her a caregiver. So it's
well,
just,
he's knowing, so that the tricky part for your dad is he's a truth sayer.
exactly.
And yeah, and yet what he is he's wrong. Okay, and so we have to help him figure out, actually, she's not either a housekeeper or a caregiver. She's here to, you know what? I'm really curious. You know, when you're fixing dinner, you know, and you're fixing something, I'm really curious. I could use your help stirring because you know what? I am not so, I don't like to keep track of stuff. So, you know, figuring out how can she come into the space not to help, but to be helped. Is there a role for her to be helped by your parents? So rather than she's there to help them, her being there is helpful. But she doesn't have to advertise.
I mean, it's been right. She's already kicked out 3 caregivers.
I'm sure she will. She'll keep doing it
So
too.
we're on the 4th. So the approach the other day was, hey, listen, the way that we're going to get this person in there is that they're here to help, and you can tell them to do whatever you need them to help you with, but
She's not buying it. She doesn't
No,
want
so-
anybody.
so-
She'll do it herself. I'll just do it myself.
so the woman came in and she just looked busy. We wanted her to look busy the whole time and then just to interact with my mother whenever, you know, she was in the room, she would say something or whatever. And that over time, they would develop a relationship. That's the goal right now.
That's where you're working. Okay, well, I like
That's where
your
we're
idea.
working right now.
Yeah, it's a good try. I mean, I think I'd be curious who's working with your dad other than you guys.
So that's the problem.
Oh.
That's the biggest problem because he doesn't get it. I don't think he's
No.
accepted that. I don't think he's accepted what
Yeah.
state she's in. He argues with her and corrects her all the time. And it just, I don't know.
So, yeah, and so I'm gonna, Esther just recently did our care, she's still in the last session. I mean, we're next to the last session or last. Cheryl, go ahead, Esther. You said something, we were starting this before we were online. You said something about our Care Partner Support Series. It's a 5-part series. It's about an hour and a half each of the parts, and it's not super expensive. We make it super inexpensive for folks to participate.
It's fantastic. I wish I had done it a lot sooner. I had learned about it almost a year ago, and I'm just now participating. And next week is our last session. And the facilitators there are so knowledgeable, and they really take you through different scenarios, and they teach you about you know, what you need to know about supporting somebody living with dementia. And they give you a chance to discuss in smaller groups, you know, your own questions and experiences. And I just found it super helpful, and I love it. And it, you know, I highly recommend it. If you can do it, do it.
Yeah.
I mean, I can do it. I just wish my father could do something. The biggest problem is he can't leave her at all. And she's always looking for him and wondering where he is and what he's doing 24/7, that it's just hard to find time.
My dad is in the same boat. You know, they're always together. So me trying to support them, I've really tried to share a lot of the different, you know, language and techniques and things with him. And you know, it's not the same, obviously, if he would be able to participate, but it does help a little bit. And it just makes you feel like you're not alone, because so many other people, their experiences mirror what I'm going through, and it just makes you feel like you're supporting yourself, even though, you know, you're supporting somebody else living with dementia. This is also a support for the caregiver. So it's really fantastic.
And Chris, I'm wondering with your dad, it sounds like he's really struggling with change himself. I mean, it's really hard for this shift, this change. And he feels that he's just got to push back, and he's got to fight hard to keep her being able to do things.
Mhm.
And he wants to push to get it so that she stays as fit as she can, kind of thing. And so wondering whether or not there's anyone in his life besides you two that and a friend. Does your mom ever have any friends?
Well, this is what's really, I mean, it's been surprising. They had a whole group of friends, but
Uh-huh.
they've all kind of disappeared. I mean, they still go and they'll go out to dinner with them, but nobody's been willing to
Take her on her
my
own.
mom.
Uh-huh.
And a lot of it, I think, is maybe they just don't feel comfortable, or they don't know what to do, or
You know what you could do, Chris? Maybe invite see if there's one or two of those friends that would come to the Care Partner Support Series with you.
maybe.
And then maybe they might be more comfortable with your mom, so your dad could get somewhere and get some support.
I mean, the saddest part is one of my mom's best friends, who lives next door, and my mother has decided that this woman is stealing from her. And it's not true at all. And it's just so sad, because this would be the woman that would be the most help.
Yeah, but the challenge is that if the friend hasn't figured out how to stay a friend, she is stealing from your mom. She's stealing her friendship. And we get so literal with interpretation of, like, she thinks she's stealing. It's like, no, your mom's right. She refuses to have the relationship, but she didn't mean it. We all know she didn't mean it, but how she's trying to be friends isn't working for your mom. And the woman isn't really skillful at this point to basically be able to say, you thought I stole something. Whoa, man, I hate that. Oh my God, I hate it, because we've always been best friends. I cannot believe that that's what you were thinking. I stole something. So tell me more about that. You know, the thing that I stole, because God, I sure don't remember taking something from you that like, I really don't. And to let her brain sort of start to figure things out. We make so many assumptions about the inability of a brain to figure things out when we cue it up and offer it the right kind of support. And sometimes we're just, well, I wouldn't steal anything. It's like, well, you did. You took my friendship and you're not giving it back. And you're treating me differently. And I notice that. I'm not stupid. I have dementia. And that feeling of being, something was taken from me on the part of your mom. Your mom's not wrong. She did lose a friend.
I just remembered the other thing that I noticed is that she stopped showering, or so, and I don't know how my dad's gonna deal with that.
Yeah, and we're not. I mean, my suggestion, let showers be off the table and do just quick wash ups, pits and crotch. Pits and crotch. If you can get to the pits and crotch, they're the important parts. That's where the bacteria builds up under the boobs if you have enough of them. Otherwise, just pits and crotch and mouth. Do mouth care if you can, because it's really important. But that other body stuff, that's like cushy. That's like cushy squishy.
It's almost
And,
like a song, Teepa. Mouth, pits, and crotch. I think
mouth, pits, and crotch. I think it'll be a top 10 if we keep this up. Oh dear. Well, Chris Ann, I'll give you one final piece there before we go offline here. Anything you want to add in?
Well, PTA, pits, tits, and, you know, I'm thinking about your parents, and one of the conversations I've had with my family is that, you know, I love all of you and I need all of you, but I want you to be healthy. And I think one of the things I would say to my dad is, Daddy, I need you. And if you give everything you have to Mom, I'm going to lose you. And I need you. And you really go back to the Kubler-Rossing thing. You know, I told my husband, you got to Kubler-Ross a lot faster. Okay. You got to, come on, you know, but you know, it's real. It's a grief you're losing, and and they don't want to lose who we were. Neither do we. But I think that's really important to acknowledge with your parents, and let them know that you need them too, and you want them to be healthy, and Mom would want that for you.
And I'm going to ask you a big favor, Mom and Dad. I'm going to ask both of you a big favor, and I know it's me asking.
Yeah.
I want us to try something, and I know you're going to hate it. I know that. But I remember when I was a teenager, you made me try stuff and I hated it. Turned out you were smarter than I thought.
You were the bumper pads in the bowling alley of my life.
Oh. All right, everybody. Thank you, thank you, thank you. Chris Ann, thanks for coming on. Thanks to everyone for being here. Rachel, thanks for monitoring. Thanks. Shelley, how was it out there in Facebook world?
Well, it was kind of slow because I posted it on my page and not yours, but we got the link out to everybody.
Oops. Oh dear.
And the recording will go there as well. But we had people
good.
comment.
Oops. Well, I mean, you're not the only person that's done that.
No.
Yeah, you know, like, oops. Well, we learned. All right, everybody. Thank you so much for being with us tonight. And we'll talk to you again in a month when will be time for some more problem solving. Thanks to everyone who made the time to come on. Thank you so much.
Thank you.
Thank you.